Pregnant women and new moms with substance use disorder undergo treatment with not only their best interest in mind, but also their babies. This is Dr. Kimberly Simcox. She's an addiction medicine specialist in OBGYN at Carilion Clinic, and the standard of care is something called medication-assisted therapy.
We do not recommend that they go off of their medications if their bodies become dependent on it, because they can suffer from acute withdrawal, and that can be very dangerous to both the mother and to the fetus.
These women are placed on medications including buprenorphine and methadone, used to curb cravings and keep them from withdrawing.
We follow them very closely, and then we continue their care until they're at a stable point in their lives when they could potentially wean off those medications. But often, as you'll find in opioid use disorder, people are on these medications for life.
Simcox compares the disorder to a diabetic taking insulin.
And we need to normalize this and treat this as any other chronic disease in pregnancy. It's just as prevalent. These women are trying to get help. They don't say, I want to take pills or I inject heroin during pregnancy. They don't say that. Nobody says that. Nobody wants that, right? We don't know what anybody else is going through.
And that's just one of the things that Dr. Jacinda Hayes has also found, but she works directly with the babies.
The moms just feel so guilty. They will start weeping while they're holding their baby.
The new transitional nursery she works in opened up about 4 months ago on the same floor of the mother-baby unit, and Hayes says that's for a very specific reason.
The mom is the #1 treatment for baby.
And they've adopted a new program developed by Yale, which incorporates more of that mom is best philosophy.
If the baby is not eating great, not able to sleep at least 1 hour, and not consolable within 10 minutes, if they get fussy, then we know, okay, well, that's because of withdrawal, and they do need some medication.
They also use this space instead of the NICU setting because it's less stimulating. Dimmed lights, no beeping monitors, sound-absorbing tiles, and rocking chairs, which helps the transition.
These babies are not born addicts. They're not born with addiction. What happens is during pregnancy, while they're in mom's belly, they get exposed to medications or substances. They're born, umbilical cords cut, and they no longer have that exposure, so they go through a withdrawal process.
Hayes' goal is to prevent that withdrawal from happening at all or lessen it, and it's working. The babies being born by mothers with substance use disorder are healthier, they have higher birth weights, and are going to the NICU less.
We've had 33 babies in our transitional nursery, and we've only had to send 1 baby up to the NICU.
The kind of partnership between physicians promoting prenatal education and counseling, in addition to medication-assisted therapy, is also paying off.